Have you been dealing with a sharp, stabbing, burning pain in the outside of your elbow when you're playing golf? Or maybe even worse, you're dealing with that pain with everyday activities like opening a door or trying to pour your coffee into your mug in the morning. Well, if that's the case, you might be dealing with tennis elbow. In this video, I'm going to break down everything that there is that you need to know in regards to tennis elbow and give you strategies and solutions to help with your symptoms. Let's just first start off with what is tennis elbow. Tennis elbow goes by a few different names, including lateral epicondylitis, lateral epicondylalgia, and more recently proposed lateral epicondyle tendinopathy. It can basically be described as an irritation of the muscle tendon unit that attaches along the outside of your elbow. The muscles that are usually affected in tennis elbow are the wrist extensors, and those originate at the lateral epicondyle of the humerus or the outside of your elbow and go all the way down into the hand and wrist. Tennis elbow commonly occurs as an overuse syndrome of your arms and your hands, typically with activities that involve grasping, heavy lifting, forceful turning, and repetitive vibration. However, those are not the only things that may cause or contribute to tennis elbow, as various other activities also contribute, such as tennis, golf, typing. It is usually thought to believe that tennis elbow is an inflammatory condition and that the muscle and tendon are inflamed, and that is what is contributing to your pain, which some of that may be true. However, more recent research has refuted that theory, and more recent research has been proposed that what is actually happening is a degenerative process of that muscle tendinous unit. So as a golfer, how do you end up getting tennis elbow? Which is a great question. One of the most common swing characteristics associated with increased stress along the outside of the elbow is going to be chicken winging. Chicken winging is a breakdown of your lead elbow in the golf swing, typically around impact. This position ultimately puts more stress along the outside of your elbow, which over time can result in too much stress and load at those muscles and tendons at the outside of your elbow, therefore resulting in tennis elbow. What causes chicken winging to happen in the golf swing? Well, there are a few different things that we are aware of that may be contributing to your chicken wing. The first thing is making sure that you have full lead shoulder mobility. That could include the rotator cuff as well as your lat. If your lat is tight, you're going to have a propensity to bend your elbow. The other thing that may be contributing to your chicken wing is that your downswing sequence may be out of whack. You may be coming over the top, and when you're coming over the top, you pretty much have no choice but to chicken wing with your lead arm, just because of how the club is moving and the path that you are taking with the club. How long does tennis elbow usually last? Well, for most folks, in most cases, symptoms usually only last anywhere between 4 to 12 weeks. However, in about 20% of cases, symptoms can last for at least 1 year. I will say it's also important to note that just because you're having pain along the outside of your elbow does not necessarily mean that that's where the pain is coming from. I highly recommend that you get a full evaluation, because there are other pain referral patterns that may be contributing to the pain along the outside of your elbow. First and foremost, it's very common for the neck to refer and radiate pain down into the elbow and even further into the arm. There's also a possibility of a muscular referral point in your shoulder that may be contributing and causing pain into your elbow. Lastly, there may also be a pinched nerve somewhere around your elbow, although this is less likely. However, it is something that is worth looking into, especially if you've been dealing with this for a while and you've tried some things and you have not really found any relief. Speaking of relief, let's go into some interventions that you can try to help improve your symptoms. First is a general recommendation for all kinds of injuries and issues that you may be dealing with your body, which is first going to be rest and activity modification. Rest can be a very boring and maybe not the most fun recommendation. However, if you are really painful, stopping the painful activity, even for just a few days, can be really helpful to bring down your symptoms, which can allow you to return back to the activity that you enjoy doing much sooner. If your symptoms are not that bad, activity modification might be a better route for you. So that might mean reducing the amount of time that you're actually playing your sport or activity that is bothering your symptoms. or it might just include changing the position that your hand and or your arm is in while you're performing a certain activity, especially the painful one. That way your symptoms do not get as aggravated. Next, let's talk about a counterforce brace. Counterforce braces do provide some pain relief. However, they're not always effective for everyone, and when they are effective, it's only for a short time. So this can be helpful regardless of your symptoms, and if it's worth to you to give it a try, go ahead. It's not going to hurt anything. Next, we have another great pain relief technique, which is going to be kinesiology tape. You can see the technique shown here on the video. If you want and you haven't seen that video, make sure you watch all the way to the end. I'll link that video up at the end there and you can go ahead and check that out. But kinesiology tape basically works on by lifting the skin to create some separation between some of those layers, all the way down to the top fascia of the muscle, which can allow for some improved gliding and movement between those layers, as well as providing some more space for some blood flow and just overall fluid flow to help carry out any chemicals associated with pain, as well as bring some other chemicals in that can help with healing. Now let's get into some hands-on and some exercise-based interventions for tennis elbow. A great pain relieving technique is going to be soft tissue mobilization. You can utilize your hand or you can utilize an object, including a tennis ball, a lacrosse ball, or even a golf ball. All you're going to do is massage those muscles that are just a little bit below where that attachment point is on the bone, and you're going to go ahead, and I generally recommend and say start off light at first, and then you can gently increase your pressure within that same session or over sessions across time. I recommend that because you don't know what your symptoms and how your body's going to react to initially applying pressure. And if you put a lot of pressure at first, you may really flare up your symptoms and you may just take 2 steps back in the process. Next is just going to be a basic stretch of your wrist extensors. To maximally get your wrist extensors stretched, you want to make sure that you perform this exercise with your elbow completely locked out and that your hand and your fingers are pointing down towards the ground. And as you're performing this drill, you should feel a stretch across the backside of those muscles of your forearm. When performing any kind of stretch, holding it for 30 seconds just one time a day is going to be more than enough to get that done. Next, let's talk about some exercise. If you are having really painful symptoms, then the first thing that I recommend with most people is starting with an isometric. An isometric is where you're contracting the muscle, however, there is nothing moving. Generally speaking, I like to have you sit down with your forearm supported on a table or something of the like. You're going to keep your wrist in a neutral position and you're going to use your other hand as the resistance. When you're performing this, you're going to hold for that resisted time for 5 to 10 seconds or so, and generally pressing relatively lightly. You're probably going to have a little bit of pain, which is totally okay and acceptable. However, if your pain is getting worse as you're performing this drill, you definitely want to calm down with how much that you're pressing and maybe hold for less time. If your symptoms are initially not that bad, or you have progressed from the isometric exercise, one of the best things that you can do in terms of exercise is eccentric loading of the muscle tendon unit. There's a good amount of research that supports this for tennis elbow, and anecdotally with myself as well as with my clients, I've used this for many folks and have seen great results with the same. You're going to be in that same setup position as the isometric exercise. Now you're going to be holding some sort of object to create some resistance. You're going to help yourself up into that set position and then slowly lower that weight down. The muscle is lengthening, but you're not letting it flop all the way down, so it's still contracting. As you're controlling and letting that down slowly, it's really going to work that muscle, and it's really going to help with those changes at the muscle tendon unit to help create better connections and just get stronger overall. Now, we just don't want to isolate the wrist extensor muscles. We also want to hit some of the muscles that are around the elbow as well, including the supinator. The supinator muscles are going to have a very intimate relationship with where the wrist extensor muscles are as well. So the setup is the same as all of the other wrist extensor exercises that we have gone over already. Now we're going to be starting in this neutral upright position as if you're holding a coffee mug, and then you're slowly going to control that weight on the way down as your palm is turning down towards the ground. There's also a good amount of research that promotes improving shoulder strength and mobility. most notably the rotator cuff and muscles around the shoulder blade. Two simple exercises to really focus on the rotator cuff as well as the lower trap are going to be as follows. The first one is just side lying shoulder external rotation. You're just going to be lying on your side. The arm that you're working is going to be closer towards the ceiling. You're going to keep that elbow pinned in towards your side, and then you're going to rotate your hand up towards the ceiling and then slowly lower it back down. Next is just going to be a lower trap exercise. You can just lie on the edge of your bed and perform one arm at a time. You're going to lift your arm up into an overhead Y position as if you were going to do the YMCA. Think about that same line of pull that your arm is up on in that overhead position. You want to utilize those same muscles to help create that pull down towards your spine. That's going to really help activate that lower trap, and that's going to overall, again, help with your tennis elbow. If you're looking for tennis elbow pain relief right now, make sure you check out this easy and effective technique.